Howdy. If you are researching CPPS to learn about all of the symptoms and to learn about all of the treatment options as well, this video will give you a fast, high-level overview of every term you're likely to run across in your search, and I'll also throw in my brief thoughts as well. So let's get started with medical conditions. These are the words you're probably learning about as you research your symptoms. First, prostatitis. It's the inflammation of the prostate gland, which is the gland that makes your semen. The problem with prostatitis is it's almost always used as this blanket category that catches everything else. It's very non-specific. When you get certain symptoms like frequent peeing or constipation or pain during a climax and more, doctors will just call it prostatitis. Then they'll run you through the steps to check for cancer and infections, but the odds are that neither of those is what you have. Chronic Pelvic Pain Syndrome, or CPPS. When you find out you don't have an infection or cancer, and you're not really sure what it is, but the symptoms are very real, the odds are that you have CPPS. CPPS is a failure of your pelvic muscles that results in many nasty symptoms. The good news is it can be cured, whereas infection and cancer can't always, at least not yet. And when you hear me give an opinion on anything in this video, it's in regard to CPPS, because that's the only condition I really know about and feel confident to speak about. Pelvic floor dysfunction. This is basically another way of saying CPPS. It's when the pelvic muscles aren't working the way that they should. There is a difference, however. CPPS is a hypertonicity of the muscles, meaning they are too tight. The opposite is hypotonicity, which is too loose. Hypotonicity often happens to women after childbirth. Both are symptoms of a modern sedentary life in which we don't move around a lot. Hard flaccid. This is a condition where your penis stays in a semi-aroused state when you're not actually aroused. It can hurt a lot, and it's very demoralizing. If you don't have it, at least you can imagine why it's demoralizing. Hard flaccid appears to have several causes, one of which is CPPS. Guys who get rid of hard flaccid often do wind up benefiting from treating it like CPPS, doing stretching and reducing stimulation and things like that. In full disclosure, I never had this symptom, but I've met with several guys who did. Erectile dysfunction is when you can't get hard at all, or simply hard enough. Pelvic floor dysfunction is one of many causes that contribute to it. Erectile dysfunction has not been something I've seen a lot in guys with CPPS, but muscle trauma and stress can be a correlated cause. Interstitial cystitis, or IC. This is when your bladder hurts and you pee all the time. Like prostatitis, it's often a blanket category. It is possible to be caused by other things, like infection or immune system problems, but like prostatitis, those are less likely. Because frequent urination is a common problem between CPPS and interstitial cystitis, it's often worth treating it like CPPS and seeing if all the stretches and stress relief actually resolve your problem. Irritable bowel syndrome, or IBS, sometimes also called irritated bowel syndrome. It's also kind of a blanket category for many problems with your digestion. Pain, bloating, gas, constipation, and diarrhea, but all of those or any of those without specific damage to your intestines is considered IBS. With regard to CPPS, the muscle tension involved in it can definitely make it hard to poop. I don't find it correlated to any of those other things like diarrhea or gas. Pudendal neuralgia is when your pudendal nerve gets damaged. It's around your plumbing, so it causes problems in that area. Sitting can cause this, and serious bicyclists often end up with this. I've met at least a couple of guys who have reported this, or at least they've been diagnosed with this condition, and yet they could not name a specific trauma to that area of their body. It's not like they jumped on a fence post and, now they've got this injury. It just started up. So again, it might be worth treating it like CPPS to see if you get any results. Benign prostatic hyperplasia, or BPH. This is also known as enlarged prostate. It causes issues with urination, like making it hard to fully empty your bladder. I don't really run into this much with guys suffering from CPPS, but if you're older or you don't get a lot of movement or your diet isn't the best, you may end up with both. And again, it may be worth treating your diet and your muscles to get rid of it. Levator ani syndrome is spasms and pain in your levator ani muscles. Symptoms include pain, burning, and they're all made worse by sitting or stress. I'm sounding like a broken record here, but again, I would rule out CPPS in this case too, because that's a lot easier to treat than some nerve damage. I would also recommend internal massage and some of the external massage methods you can do yourself. Symptoms. All right, let's quickly fire through some symptoms related to CPPS and their medical names. Pelvic pain is a blanket term for pain around your plumbing, stomach, and lower back. Basically, anywhere around your plumbing, but not specific to the legs or abdominal muscles. Dysuria is when it hurts to go pee. It's related to more than just CPPS, so keep that in mind as you search. Does it hurt in your penis, or does it hurt in the muscles around it, or both? If it's pain in your penis or bladder, it could be something other than CPPS, but not necessarily. Frequent urination is going often, sometimes more than 10 times per day. And when I had bad CPPS and I was working in an office, I was going more than 20 times per day. I would be looking at my watch in meetings to see when I could get out and go. Urgency, the feeling like you can't hold in your pee. In lieu of CPPS, that's because the muscles that hold in your pee are quite tired out. Nocturia is going pee a lot at night. If your urgency or frequency are only at night, you may be suffering from something other than CPPS, but again, not necessarily. Hematuria is blood in your urine. I've heard guys talk about this when having CPPS, but if you're experiencing this, have that checked out by a doctor. I don't think this is ever caused by CPPS. Dyspareunia is pain during sex. I think it's possible to be a CPPS symptom, but more often CPPS causes the next thing, which is ejaculatory pain. CPPS causes massive ejaculatory pain, or at least it did for me. It's a hallmark of it. In fact, it's probably the single most unique symptom of CPPS. It hurts so bad that sometimes I wish I'd never had sex in the first place, and that is saying something. Perineal pain is pain around your plumbing, or the more medical term, your taint. If you have CPPS, you'll often find knots or sore spots around this area. The pain also seems to get worse the more stressed out or tired you are. Lower back pain. Pain in your low back can accompany pelvic floor dysfunction. The psoas, in particular, is wrapped into many parts of your spine as well as your pelvic floor, but your hip flexors and the other muscles play a role as well. Now let's talk about what people believe causes CPPS. Pelvic floor dysfunction is when the muscles of your pelvis are damaged and then cause other problems. It is my opinion that this is half of what causes CPPS, and that it's treatable. Inflammation is when something in your body goes wrong and your body creates an immune response to it. Stress, a cut, an allergen, many things can cause an immune response. The response itself includes your blood vessels widening and your body sending blood, oxygen, white blood cells, and more to the affected areas. But the thing is, inflammation is always a symptom of something else. It can't cause CPPS. Nerve irritation and neuropathy are when nerve damage causes pain, tingling, or burning. It can be from a pinched nerve or from a repetitive strain. While those are very real things, my experience is that CPPS can be the cause of nerve pain, but not the other way around. Bladder issues like infections are sometimes thought to cause CPPS. I find that they're a real problem, but not the same thing. CPPS isn't caused by infections or any malfunctioning of the bladder. Stress and anxiety are, to me, the ghost and the darkness. You know what they are, and I will tell you they are at least half of the CPPS equation. Guys who tell you that the entire cure is just a stretching routine probably never had CPPS. I have a lot to say on the subject, but let's just keep it at this. Stress and anxiety are treatable, and you can beat this. Porn and masturbation both make CPPS worse and are worth stopping, but I don't think they're direct causes of CPPS. Pornography is addictive, I should know, and causes shame, and this leads to further anxiety, which will make your symptoms worse. Trauma or injury, like landing on a fence post, that story I described earlier, well, it might be able to cause CPPS, but I've never met anybody whose symptoms began with an acute injury. I have found that CPPS is closer to a repetitive strain injury, at least that's what I think. You're sitting a lot and you're clenching those muscles out of stress while you're sitting at work, but at other times you may be adapting those same muscles to opposite movement patterns using exercise, like squats or biking or running. Autoimmune conditions have a number of variants, and while I have little experience with them, it is possible they contribute to making CPPS worse. But they're not the root cause, and if you have one, I have met people who have greatly reduced their symptoms by changing the way they eat. All right, next let's look at common treatments and medications used to treat CPPS. Antibiotics. First, pretty much everybody gets the standard issue dose of antibiotics to rule out bacterial infections. What they're usually looking for is a sexually transmitted disease. A common one that you end up taking is Cipro. If the problem stays after you take antibiotics and you don't have symptoms like pus or anything coming out of your penis, then you've ruled out bacterial infection. Some doctors will try to keep you on antibiotics in perpetuity, which is ineffective, expensive, and helps create superbugs, so don't let them do that. Alpha blockers are muscle relaxants. They're most commonly used to treat BPH. They might help symptoms of CPPS, but they don't fix the problem. I've met some guys who said they felt dizzy on alpha blockers, and they are not a long term solution, so don't feel bad if you have to get rid of them. Steroids are super powerful inflammation reducers. They can sometimes reduce symptom severity. They are, however, a band aid in almost any application, and they are here too. Antidepressants and anxiety medication are used to treat anxiety and depression in people with chronic pain. They can also slow pain signals. It is my staunch opinion that antidepressants merely numb the joy you can feel, slow down the natural operations of your body, and rob you of your personality. They will also make it harder to fully break free of CPPS. Gabapentin and pregabalin are anticonvulsants, usually used for seizures that double as nerve pain tamers. They are more often used for pudendal neuralgia. I think with CPPS, they're another band-aid. Finasteride is a drug that blocks DHT, which is a hormone that fuels prostate growth and inflammation. In male pelvic pain, it's mainly used to shrink and enlarge prostate, also known as BPH. My opinion is it's still better to treat those processes in your body naturally with better routines, more movement, and a better diet. Pentosan polysulfate is a drug for interstitial cystitis. It is used to patch a leaky bladder wall, which sounds really painful. I have not had genuine interstitial cystitis, and maybe this is necessary in the short run, but in the long run, work with your body's epigenetics to fix this problem. That's the same kind of stuff: diet, exercise, sleep, the useful stuff. Antifungals. Sometimes pelvic symptoms are from infections, and some of those infections are fungal. If you're having fungal issues, you probably have a weak immune system and should consider that as you create your new routine. Anti-inflammatory supplements can reduce inflammation and thus make your symptoms a little less severe. I had no perceived benefit from using supplements like ibuprofen, but if they're helping you and you know the risks, I think using them is okay in the short term. Reducing pornography use. Quitting porn comes up online because guys wonder if their 2 to 10 times a day addiction that stimulates their plumbing isn't the problem, which makes perfect sense to ask that. I have a video explaining why I don't think this will actually cure CPPS, but to be honest, quitting might make everything else in your life easier, including curing CPPS. Last, I want to talk to you about what to remember. First, you are the expert. You need to trust your gut. If you spot a pattern or a correlation, then you should test it and see if it works for you, regardless of what anyone else says, including me. Second, you don't need to know all of the terminology to beat CPPS. I hope this video was useful, but you don't need it all, and you don't need to know every muscle in your pelvis that connects to the psoas and so forth. You just need a routine that addresses your problems. And third, the secret sauce is consistency. Once you find out what works, you need to do it 1 or 2 times a day and just keep doing that until everything gets better, and then learn from those patterns. Your body needs to move around a lot. So when you have CPPS and you treat it that way, you're ultimately going to get stronger because you're going to build some patterns that strengthen both your mind and your body. So keep your knuckles up.